and it's myself. Okay, being recorded. Good. Dr. Thomas is Karen Thomas is my main attending physician, and she and I are the movement disorders team. We also run a Huntington's clinic, a deep brain stimulation clinic. So we work pretty hard. So I appreciate you all having me, and it's so nice to see a really active support group. I help to run a young onset support group, so people who are 60 or under and have Parkinson's disease. So we've been doing that for a while. It's nice to see you all continuing to meet, even if it is on Zoom. So thank you for having me. And if you have a question, this is not a terribly long presentation, but I can get wordy. And so if you have questions, just unmute yourself and interrupt me. You can also wait till the end. If you have a question that's not related to what I'm talking about, waiting to the end is probably a good idea, because I'll get lost too. Let me know if you have any questions. Can everybody hear me okay? Okay, good. All right. So this presentation is talking about GI issues in Parkinson's disease, which are extremely common. Most of you are likely dealing with some of these. And a lot of people don't recognize the severity or how common they are in our patients. And I have to treat gastrointestinal issues in most of my patients. So for 12, 15 patients a day, however many I see, I'm talking about constipation and swallowing with every single one. And so it's very important. And we'll talk about these a little bit more specifically. We're going to work. There we go. So why do we even talk about the GI tract in Parkinson's disease? So if you don't know, and I'm sure this is a pretty active support group, so you're all probably researched up and have done your own research, but the protein that folds abnormally in Parkinson's disease is called alpha-synuclein. And we don't know exactly why this happens, but it seems to begin to fold abnormally in the gut. And, there are some studies, and we believe it travels up a nerve that goes up from the gut into the central nervous system. And so this is why, because it starts in the gut, constipation can happen many, many years before other symptoms. I have patients all the time that come in and say, I've had constipation for 20 years. That has nothing to do with anything. And I say, no, it actually could be the start of all of this. It could have been the beginning of this. And so constipation can happen a lot. Happens a lot in the general population too. I'll get a few consultations a couple times a year where someone just has constipation and they heard that it could be Parkinson's disease, so they're worried. So I always try and counsel them. That doesn't mean you're going to get Parkinson's, but there we go. Other things that can happen in the gut, inflammation and infection seem to happen more in Parkinson's patients. And we don't know if it's caused by Parkinson's disease or it causes Parkinson's disease. Is the inflammation, are the infections the cause of the abnormal folding of the alpha-synuclein, or is it caused by that? We don't know. But some studies have shown that about a third of patients with Parkinson's have H. pylori, which is the same thing that can cause other stomach issues and ulcers and things. And people who have H. pylori also have worsened fluctuations. So when you're on carbidopa levodopa, if you have ups and downs, there are some schools of thought that want everybody tested that have those ups and downs for H. pylori infection, so a stomach infection. So that's really interesting. There's also bacterial overgrowth in the small intestine that happens in Parkinson's patients. And also people who have intestinal issues, Crohn's disease and ulcerative colitis are at higher risk for Parkinson's disease. Again, we don't know why. Is it because there's an abnormal, there's abnormal bacteria that's causing inflammation? And so just some interesting thoughts about why stomach issues happen in Parkinson's and some theories about why the disease seems to start there. So sorry about my little picture here. I thought it was pretty accurate. So constipation, I hear about it all the time. 80 to 90% incidence in Parkinson's patients, again, can occur decades before other symptoms. Um, and it's just a part of everything kind of slowing down, and we have damage to this part of the nervous system. So the gut is slowed by medications. People are eating and drinking less over time just because they're slower in eating and drinking. Digestion slows. And then medications. Sometimes Parkinson's medications can worsen constipation, although I have some that say it helps, but in a lot of patients, constipation can be made worse. And so this is really common in a lot of my patients, and sometimes can be really bad to the point of hospitalizations. People can get blockages and end up, not having a bowel movement for weeks. And it's terribly uncomfortable, and in some cases can cause altered mental status. And like I said, hospitalizations and small bowel obstructions, and it should be taken very seriously. And so we treat this generally, most people, including myself, don't drink enough water or fluids in general. And we really have to push fluids. And, I try and tell my patients, look, if you're taking carbidopa, levodopa, or Mirapex, or whatever you're taking 3 times a day, big glass of water with your dose. And then in between, set an alarm or something to have a big glass of water. Whatever system you use to get those fluids in, it's so important all throughout the day. And not just for constipation, but also for blood pressure regulation. People who have Parkinson's disease are at higher risk for their blood pressures dropping over time, especially when they stand up. You have to hydrate. In addition to the rest of your body needing to work well, kidneys, things like that, it's important. Exercise helps with constipation. You got to get up and moving around. And, that's the only thing that slows progression of Parkinson's anyway. So if you can slow progression and work on your constipation with exercise, that's fantastic. Fiber, of course, you have to have the water with the fiber though. Smaller, more frequent meals are going to be more helpful because of slow digestion. And so doing those small, more frequent meals can just help things move a little smoother. And if all else fails, then we'll suggest stool softeners like a Docusate, Colace, laxatives, things like Miralax can be helpful, or prescriptions. Some of you have heard of Linzess, things like that. By the way, I don't get paid by any drug companies, if you're wondering. But we kind of go on that stepwise fashion, start out with those conservative things and then end up with prescriptions if needed. And sometimes we'll even need to get GI, gastrointestinal doctor involved for assistance with these sort of things. Is there anything else going on? We have a saying in our clinic anyway, you can have ticks and fleas. And so if someone has severe constipation, no matter what I'm doing, no matter what I give them, a lot of times I'll involve a GI doctor to help, especially if someone has ended up in the hospital with severe constipation. So that's why it says, take this seriously. My personal favorite for a lot of my patients, and some might disagree or have their own formulation, plenty of fluids, having the fiber, but also I like Colace for softening and Miralax to help things get going. Those are my personal, what I tell people to do. But again, every clinician probably does things a little bit differently. In addition to following up with the primary care doctor to make sure nothing else is going on. Okay, are there any questions about constipation before I move on to swallowing difficulty? Okay, so swallowing difficulty is probably the scariest thing that I deal with, aside from falls, in my Parkinson's patients. So it's pretty scary for us. Medical term is dysphagia. And then you hear about aspiration. And that's the technical term about when food goes down the wrong pipe. And that happens to all of us at some point. Food goes down the wrong pipe, and that's just kind of part of being a human being. But it happens more in Parkinson's patients because of the slowness and stiffness of Parkinson's, and that even does that to the swallowing muscles. And so when food goes down the wrong pipe, it goes into the lungs, and that can cause an infection called aspiration pneumonia. And aspiration pneumonia is actually the #1 killer of Parkinson's patients. And so when someone says, well, I say, are you having swallowing problems? Well, no, I'm fine. Are you choking when you eat? Are you coughing when you eat? sometimes, and sometimes food goes down the wrong pipe, and people tend to really downplay this. But I really get my haunches up when that happens, and really try and talk about it and involve a speech and swallowing therapist very quickly. In fact, my patients meet with speech therapy on their first or second visit after diagnosis, because we find this extremely important. Signs of swallowing problems, you can see them right there. They make sense. Weight loss, drooling, heartburn, coughing when eating or drinking. Speech and swallowing therapy is really important. And I have a lot of patients who've done speech therapy, and then I'll say, well, did the speech therapist talk about swallowing problems? And they say no. And I'll send them to someone else, or we'll have a discussion about it. Because speech therapy can help with swallowing problems too, regular speech, but we need those swallowing techniques and tips and tricks that really help prevent death. And I really like to use my Parkinson's certified therapists, physical, occupational, and speech for these sort of things. But often, depending on the community, you need to use others, and that's fine too. I just really prefer the certified folks. And then we'll get swallow studies. So modified barium swallow to take a picture of what's happening as you're swallowing different consistencies. So they'll give you a liquid or a thickened liquid or a graham cracker. And at what point does it go down the wrong pipe? Do you have to double swallow something to get it down? Is food pooling in the mouth? Or liquids pooling in the mouth? Those things are real important. And I really like that type of study because a speech language pathologist is usually in the room while it's happening, and they can give immediate feedback. So you leave that test knowing, hey, okay, well, I need to use a straw, or I need to not use a straw, or I need to tuck my chin, or I need to go to swallowing therapy. That type of test is really helpful, and it's different than a regular barium swallow that a GI person is going to order. I like the modified. And so your specific doctor, your movement disorder specialist, is going to know what to do in this case. But if you notice that you're having problems with coughing, or you're losing weight, that sort of thing, just make sure that you bring that up. And some folks really don't realize how slowed their swallowing and eating has gotten. Not only the swallowing, but just getting the food to the mouth. And, with lack of taste and smell, you kind of lose your appetite and things. And so all that can lead to weight loss. And so really make sure that you discuss this with your primary neurologist. Any questions about this before I move on?
Yes, I do. When you're talking about techniques to help with swallowing, because I know my husband has many of those things over there on the list. These talk about tuck to chin, using the straw, and so on. What are those techniques that would help him to swallow, especially during a mealtime?
Yeah, and so it really depends on what the specific problems are. And that's why a modified barium swallow is really helpful. So you can actually see what's happening as things are going down. And so it's hard to say without seeing that and knowing the person specifically, but sometimes we will do chin tucks or using a straw, like I said. Some folks, though, a straw is not a good idea and they should stay away from that. So it just kind of depends on what that swallow study shows. Some people have more problems with certain consistencies. So like breads, or a dry chicken, those sort of things. And we'll have them just try and keep them moist. So if you're going to eat a dry bread, have a little, olive oil or something with it. Or if you're going to have steak, make sure you have your A1 sauce, whatever it is to help coat that and get it down. Of course, small bites with water, and again, that depends on the person, and a speech language pathologist is going to be really the best person here to help with that. But doing those sort of things can be helpful. Small meals cut up. Some people, they have to puree certain things. So it really just depends on the person. And using common sense too. So people tell me sometimes, well, every time I eat peanuts, I choke. And I think, well, it sounds sad, but maybe avoid the peanuts. And so just using common sense type of tactics there can be helpful as well. And doing your exercises, your voice and swallowing exercises that the speech therapist has taught you are important. You need to work on those every single day. And if you haven't seen a speech therapist, I would highly encourage you to see a Parkinson's certified speech therapist.
Leslie,
Yes.
what about chewing your pills? I tend to chew my pills to get them down. Is there anything wrong with that?
That's kind of gross. So I'm sorry you have to do that. It depends on the pill. So usually an immediate release levodopa is okay. Some of them are not okay though. And so when people have difficulty swallowing pills, what I generally tell them, and some of this, I'm always kind of shocked if I just ask simple questions. Okay, how many pills are you taking at one time? And some people will say, oh, I'm putting all of them in my mouth and I'm swallowing them dry without any water. And I'm thinking, come on. And so one pill at a time, sip of water after your pill. If the pill itself is too difficult, you can, if it's a scored pill and it's okay to cut it in half, try half at a time. If it is a pill that is just simply too large or rough to get down, you can use applesauce or pudding or yogurt. Something that actually coats the pill to help get it down can also help. There's something that some folks do called floating the pill, where you fill your mouth up with water first and kind of keep it closed and then stick the pill in there and then swallow it as it's floating in the water. So there's several different techniques. As far as chewing the pills, have fun with that. But it depends on the pill. You have to ask your doctor.
Okay.
Because some of them you shouldn't be crushing up.
Leslie, this is Craig Little.
Hello.
Hello. I've been especially helped in both speech and swallowing by the Parkinson's Voice Project, which is very good at both speech and swallowing. And they have local speech therapists who specialize in Parkinson's disease.
Absolutely. Absolutely. So, where you are, if you all have this support group, I'm sure you have everything you need in that regard. But yes, we have things like the loud crowd and, other things around for folks to really work on. And so many different, support groups and exercise classes or doing things on Zoom. We have Rocksteady Boxing, and in Rocksteady Boxing, even they're working on their voice and they're making them scream and do their counting and this sort of thing. And so there's always something that you can find in your local area, but we have all of that, and I'm sure you all do too. So definitely use those resources. And a lot of people really, not that they kind of poo-poo on it, but they don't think that speech and swallowing therapy is as important as physical therapy. And they'll say, oh, I don't want to do speech right now. My voice is fine, as I can barely hear them talking. But they want to do physical. And I understand that kind of thought because you want to prevent falls and the physical's more visible. But if you look at this, knowing that swallowing problems are the #1 killer of Parkinson's patients, that's not true at all. We got to stay on top of the swallowing and the speech issues.
Right.
And so definitely use your resources. And a lot of our patients do the loud crowd specifically, and love that.
That's good.
Definitely
I've
use
been
your
doing that
resources.
myself.
Good.
It's very good.
Okay.
Any
other questions?
Constipation, I wondered if Metamucil you didn't mention that at all. And Metamucil, I've been taking Metamucil for a while, and it's very helpful, I think.
Yeah. So Metamucil is a type of fiber supplement. I did mention the fiber, and there's many different types. There's the mixes with the waters, and there's pills, and there's chews, and there's a lot of different things. So definitely fiber can be helpful. You have to have the water with the fiber though, because if you do too much fiber, which is a bulking agent, you could throw yourself the other way.
Yes.
So you really have to make sure that you have that hydration. Fiber's good, and make sure your diet has a good amount of fiber in it too. So nice roughage can certainly be helpful, but yeah.
Lisa, Leslie, I had a question. I drool, and as you can tell, my speech is off, but I've put more emphasis on the physical therapy than I am on speech and swallowing, because I didn't know that the two were related.
Yes,
Yeah.
they are.
Yeah, absolutely. Yeah, and so drooling is something that happens. Like I said, it can happen with swallowing issues, but drooling happens in Parkinson's patients for many reasons. One is just kind of a little bit of increased secretions. Another is because people with Parkinson's swallow less. So they blink less and they swallow less. And so that's part of that slowed movement. And so whereas every once in a while, without even thinking about it, I'll just kind of swallow my spit. I know it's gross, sorry. Every once in a while, just without even thinking about it so that I don't drool. People with Parkinson's do that less. And then in addition to that, you have the mouth that kind of, the facial muscles will become a little slack too. So we have that flatter affect. And so sometimes the mouth can hang open. So we have pooling of the spit, increased secretions, and our mouth is hanging open. So you're just gonna start to drool. And so in some folks it depends on if it's safe for you to chew gum, but in some folks chewing gum can help with the drooling. And of course, if I don't know you, so I can't tell you whether it's safe for you to chew gum, but if it is, sometimes that can help to stimulate that swallowing reflex, chewing gum. And we'll have people do facial exercises, and speech therapists teach a lot of those facial exercises, but I know some physical therapists that do that too. And you can also look those up online. But then also making the conscious effort, just like when you mindfully walk and you're walking, to mindfully swallow. Okay, I'm drooling, I need to swallow, I need to get some of this down, and drinking those fluids too to help get, to clean things out. And then with the drooling, sometimes we'll use medications if those things don't work. If someone's not diabetic, sometimes I'll use papaya enzyme to help with thick secretions, because that can help thin them out. And I said not diabetic because it's papaya, it has sugar in it. And there are some medications that we use for drooling too. I really like to use those as sparingly as possible because they can sometimes cause cognitive issues and just kind of dry you out too much. I really like for those therapists to be involved right away. So if you haven't been doing that lately, really talk to your doctor. Maybe you need a speech therapy evaluation.
Leslie, you mentioned Linzess.
Yeah.
The new drug. Is that good? Do you recommend that?
I like Linzess. I mean, again, they don't pay me any extra here. I have some patients that like Linzess and they need it every single day. I have some patients that kind of get to an as needed place with Linzess. They do okay, but if they take it every single day, they'll get diarrhea. And so they'll use it on an as needed basis. I have some folks that take it every other day. And so I like Linzess, but I like to use it as a last resort. Newer medications aren't cheap, unfortunately. Any other questions for this?
Let's talk about my stool, okay?
Oh,
Let's get right down to the nitty gritty. It's very hard, and it's sometimes clogs up the toilet. So it's so hard.
Uh-huh.
Is that a symptom of Parkinson's? What is that?
Well, remember your stomach is emptying slower. And so the stool kind of backs up and you're just not transiting it as fast. And so, yeah, it gets harder. And, people with Parkinson's are a little more prone to dehydration. So you don't have a lot of water in that stool. And so if your body is dehydrated, guess where it comes from? It comes from the stool. And so you're left with hard to pass stools. So plenty of fluids are important.
Right.
And then Colace is my go-to for stool softener. Again, hard for me to give medical advice if I don't know yet, but Colace is my go-to stool softener, plenty of fluids. And that might help you some, and move around if you're not exercising.
Yeah.
Okay, can we move on from the stool talk? Okay. So we just talked about this. Drooling. Great. I already did it. So there's my Patrick star there. If any of you have kids or grandkids, you know about SpongeBob SquarePants, and Patrick star is always drooling. And so this kind of talks about what I just already talked about. Technical term is sialorrhea. The one thing that I did not bring up is Botox injection. So I don't know how much you all have heard or know about Botox injection. We use it for wrinkles, we use it for headaches, we use it for sweating, but we also in Parkinson's use it for spasticity. So if someone has a limb, so a foot or an arm that is spastic, so it's difficult to move and extend, we can go in and inject those muscles and loosen them up. And we do that for other types of patients too, stroke patients, different neurologic conditions. But we can also inject into the salivary glands. We can use Botox, and then there's another similar one that we use that can help reduce drooling. That would be last resort. We do a lot with our Lou Gehrig patients, our ALS patients in this clinic as well. So that would be something. If you had failed everything else, we would talk about this sort of injection. And it's actually not a hard injection. These are big salivary glands, so it's not a difficult place to get.
Will it clear up my baggy neck?
No, it will not clear up your baggy neck.
Okay.
When I find something that will clear up baggy neck, you'll see me on the news, and I will be in the Caribbean somewhere, I'm sure. Okay. So we talked a little bit about just kind of slowing down. And remember, in Parkinson's disease, everything slows down. And that includes what we call gastric emptying. So how fast things are moving through your gastric tract. Slowed gastric emptying is called gastroparesis. It happens, I love this statistic, 40 to 90%. So some studies are showing 40%, some of them showing 90%. It's a lot of people. But you can get sick to your stomach. You can feel bloated. You can feel full faster. Weight loss can happen just because people don't want to eat as much because they feel this way. It's important to know, though, that this also happens in other conditions like diabetes and several other things. And so let's say I have a Parkinson's patient who has diabetes, which is a lot of my patients. And, this can get really bad. And so, really focusing on small meals throughout the day. And a lot of times I'll definitely have a GI doctor involved here to make sure there's nothing else going on. And sometimes we'll use medications for this, but most of the time it's behavioral. Don't eat, 2 giant meals during the day. It's not going to go down. You got to, have the smaller meals, have your fluids, get your exercise in, and then make sure any other health condition that's contributing to this is well controlled. Is your Parkinson's as optimized as you can get it as far as your medications? Is your diabetes as well controlled as you can get it? And anything else contributing? And that's why, and have you seen a GI doctor? Do you have any blockages? Is there a hernia? Is something else going on that's contributing? So a lot of times we need a lot of people's help for this, but this can happen too. Any question about gastric emptying? This presentation is full of fun words. Okay. So another thing I kind of like to talk about, and it sort of fits in this presentation, is medication issues when it comes to the stomach or the GI tract. Nausea can happen, like we were just talking about, with delayed gastric emptying, but it can also happen as a result of medications. And if you're a Latin fan, the term sin-emet, so the medication carbidopa, levodopa, brand name is Sinemet. And so emet means vomit and sin means without. And so the goal of the carbidopa in the levodopa, among many other things, is to help prevent nausea. And so sin-emet. Because if you just give plain old levodopa, there's plenty of issues there, but nausea is one of them. And so the carbidopa helps with that. And so nausea can happen with most of the Parkinson's medications, and it can be pretty bad and prevent people from taking medications. And as you all know, in Parkinson's, I don't have a million medications for Parkinson's. And so there's different variations of the same medication. Sinemet has a million different variations, but it's still the same medication. And so I really, really try to counsel people on how to prevent nausea when I'm starting a new medication. And part of that is doing a very slow titration with medications for Parkinson's. And I do really slow. In fact, it's probably a little too conservative. But I do really, really slow. It usually takes me about 4 to 5 weeks to even get to the lowest therapeutic dose of many medications. And, you know, a lot of people really try and avoid food, especially with Cinemet when they're taking it. But when someone's first getting started, I tell them not to worry so much about it because it can cause nausea. I just want to get it into your system. If you need to take it with a little food to begin with, that's okay. Sometimes we will use medications to help with nausea, and there's many of them. You have to be careful though, because sometimes some of those can cause abnormal movements too. So we tend to be careful. Of course, ginger products can help. So like a ginger snap, a ginger tea, ginger ale can sometimes help with nausea related to medications. So we have a few different tips and tricks for that. Next, this is kind of what I was just talking about. People, you know, if you read about levodopa on the internet, don't eat with it, all that sort of thing. And there's truth to that. Protein in and of itself can decrease the absorption of levodopa. And so if you take your Cinemet or your carbidopa levodopa right on top of having a meal with any amount of protein in it, or especially high protein, that dose of levodopa is probably not going to work as well. It's not going to hurt you. You'll be okay, but you might have some wearing off, or that one dose might not just work as well. And so, like I said earlier, when people are first starting off on the medication, I tend to tell them, you know, you might read that, don't worry about it until I tell you to worry about it. And I start to worry about it when people will have fluctuations or they'll have doses that don't work as well as they used to. I'll say, okay, well, you know, take your meds and then, you know, don't eat for half an hour, 45 minutes after, or if you eat, wait an hour after to take your meds. Some folks that's difficult because they're taking Cinemet 12 times a day. And so in that case, we just kind of do our best. And I've had some patients that really take this to the extreme and cut out all protein out of their diet and all these things without talking to me about that. And that's just, I don't like that at all. You need protein to live. Your muscles need to function. And so I don't suggest that either. And we just try and balance that out. And this talks about, you know, if you have slowed gastric emptying and constipation, that impacts the absorption of your carbidopa levodopa as well. And other medications too, because if you are full of stool, then the sides of your intestines are not going to pick up as much levodopa as they would otherwise. And then if you have, you know, slowed emptying and then all of a sudden it goes faster, sometimes that levodopa will absorb faster during some moments than others. And so trying to keep things on a steady, even keel as far as your GI tract is important with medications. And that is all I have. Another thing, and I don't know if I talked about this, there's a lot of discussion about probiotics and prebiotics and that sort of thing. You know, I tend to like a good probiotic, and, you know, if you're just eating a healthy diet, that tends to, and a healthy, even consistent diet, that tends to help with things. But you know, if patients want to try a probiotic, that's fine too. I don't mind that. And I don't care what brand. So that's my spiel. Does anybody have any questions?
Leslie, this is Gail. You mentioned with the drooling that chewing gum could help. Tell me, why would that help? Is it increasing the saliva so it forces them to swallow? Yeah,
so chewing gum, when you are putting focus on your mouth and you're chewing gum, you actually remember more to swallow. And so it's putting focus on that area. And, you know, the same thing would happen with hard candy, or, you know, putting any sort of focus on anything in the mouth, and you'll have a swallowing reflex a little bit more.
Would they swallow more regularly if there was more liquid in their mouth?
That kind of depends on the person. So that kind of depends on the person and their cognitive status and things like that. I wouldn't push a whole bunch more fluids in the mouth just to get someone to swallow more. But if they are eating more and drinking more fluids, then that will definitely stimulate. If you have to do something where you're putting focus on the mouth, then that would stimulate the swallowing reflex. Yes.
Thank you.
Leslie,
Yes.
this is Diane. I have a question about, in the beginning, you talked about something folding over in the intestine. Could
Yeah.
you explain that to me, what that is?
Yeah.
that
So
means?
this is just kind of Cliff's notes. In Parkinson's disease, there is a protein that builds up abnormally or folds, kind of flattens out abnormally. And it's called alpha-synuclein. And it happens in Parkinson's patients specifically, and we do not know why this happens. And it happens in the cells that make dopamine. And so as that protein folds abnormally, those cells start to malfunction and die off. And so they make less dopamine.
Oh, okay.
And so this starts down all the way down in the gut, in the stomach. The cells in the gut can happen with this too, in the intestines. And so it seems to start there. The protein starts to fold abnormally there and then travels upwards to our central nervous system.
Oh, okay.
And so we don't exactly know why this happens, but that's what we believe. And that's why we think people have slowing of the gut 20, 30 years before they have other symptoms, is because that slowing that starts in the gut, and that protein starts to fold abnormally there. It's called alpha-synuclein.
Thank you.
No problem. Any
This is
other
Mark, Leslie.
question?
Mark has a question, Leslie.
Okay.
The alpha-synuclein, the research going into the alpha-synucleins that helps unfold them. And there's a drug similar to the Alzheimer's drug that they just approved. Do you know anything about that?
Yeah. So
Study?
we're doing some studies on these drugs as well. And there's several different companies that are making drugs like this. Most of them are going to be maybe IV type of drugs. So once a month or whatever, you go and get your infusion. And the goal of it would be to help, I hate to say stop the disease in its tracks, but that would be the ultimate goal, is to stop any more abnormal folding from happening, would be the goal. And so it might not reverse things, but to be able to stop that any more abnormal folding from happening, that would be great. I mean, if we could recognize this early and say, okay, you're going to go get your infusion, and then you will just kind of stop the disease where it is for you, that would be wonderful.
Mhm.
And so, that to me, that's the next best thing to reversing the clock, is to be able to stop it where it is. And so we are doing research on that. There's nothing I can give to patients other than research right now. And it's all theory, and some of the studies are still ongoing, and we don't have enough information to really give out yet, but we're working on that. Yes. COVID really put a big damper on research in general. So really trying to recruit those subjects and to have the personnel to actually do the research was really hampered by COVID. So we're getting back in the swing of things, and hopefully over the next couple of years, we'll have more information for you. Those type of drugs, they can be pretty heavy drugs. And so we have to, infusions, we have to be careful and make sure that it's safe.
Thank you.
No problem. And this is an aside, but I get excited about drugs like that because, let's say someone comes in and they have constipation and lack of sense of smell, which happens in, 95+% of Parkinson's patients. They lose their sense of smell, sometimes very early on. So I have somebody that comes in and they've lost their sense of smell and they're constipated. We could potentially, there's workup being done on markers for Parkinson's. Can we do a DAT scan? Can we check their salivary glands or their skin for abnormal folding of that protein? And then at that point, could we give them that drug? So there's so many cool applications and things that are so interesting about research right now. And I really can't wait. And Michael J. Fox has a really good website for all that. And I'm sure your support group has a lot of really good resources, but it's a very exciting time to be in Parkinson's research.
Right, you can't wait. We certainly can't wait.
I know. like I said, when I invent all of this and I give it to you all, then I'm going to drop off the face of the planet. Okay.
Okay, okay.
Any other questions?
Well, I'd like to thank you for this great discussion.
Yes.
I happen to be a retired gastroenterologist, and I
Oh,
agree with
wonderful.
100% of what you've said.
Oh, well, that's nice. Thank you. Thank you.
And
Okay.
I would agree the thing to attack is the swallowing and the speech.
Absolutely. Yeah, I really encourage folks, and I think probably the saddest part of my clinic, and it happens at least once a day. I have a patient who comes in and it sounds like they've had symptoms of Parkinsonism for 10 years or something, and they look terrible, they feel terrible. And, no one's ever had them see a physical or speech therapist. And like I said, I do that day 1 or day 2 of knowing my patients, even if they have extremely mild symptoms. And so that's probably the hardest thing, is knowing how much exercise and doing these preventative things could have helped this person. And so definitely talk to your doctor about, if you're already not doing therapies, make sure that you talk to them about it. And if you were kind of on the fence about speech therapy or swallowing therapy in the past, I really encourage at least an evaluation. Okay.
Thank you very
Well,
much.
if there's no other questions, I'll sign off. I can send my contact information, my email and things to the host, so that if you all have any questions for me, you can always let me know. Any other questions before I sign off?
Thank you very much. You've been great.
Okay.
Thank you.
Thank you.
Okay. Thank you all so much. Have a good day.
Yeah.
Thank you so much.